Good morning, and thank you for joining us. My name is Louis St. George, and I'm the Media Relations Specialist here at Essentia. It's been a while since we've come together like this, and given the rate of COVID-19 case growth across our region, both us and St. Luke's thought that it was a really good time today and this week to reconvene. Our goal is to pass along some important messages, highlight COVID's continuing threat, and answer some of your questions. As in the past, we'll start with opening remarks from Dr. John Pryor, President of Essentia Health's East Market, and Dr. Nick Van Deelen, Chief Medical Officer at St. Luke's. Also with us and available for your questions are Drs. Prabhu and Thompson, infectious disease physicians at Essentia and St. Luke's, respectively. For those questions, please raise your hand to be called on or submit them using the Q&A button at the bottom of your screen. And we'll try to get to as many as time allows, planning to wrap up right around 12:15 or so. So with that, I will now pass it over to Dr. Pryor.
Welcome, everyone. I'm Dr. John Pryor, President of Essentia Health's East Market. Well, here we are again discussing COVID-19 in a virtual setting. When we were having press conferences regularly in the spring, cases of COVID were sparse in the Northland. That's no longer true. In fact, while the Twin Cities were among the hardest hit early in the pandemic, some of the most rapid growth recently is occurring in greater Minnesota, in communities just like ours. We've been planning for an influx like this since spring. Unfortunately, we have the potential for a perfect storm of COVID patients, flu patients, and an increase of patients with medical problems because they have not gotten the care they need. We're asking for your help to prevent this perfect storm. Since the onset of COVID, many patients who needed either preventive care or who have chronic or comorbid diseases like hypertension, congestive heart failure, or any multitude of health issues have been reluctant to seek medical care. The result is that their sickness has worsened dangerously. So instead of seeing them for preventive care, we're seeing them in the emergency room. Consequently, our hospitals are full, not so much of COVID patients, but patients with medical issues. So here's our main message for today. If you need care, please come see us. The alternative could be disastrous. At St. Mercy's Medical Center here in Duluth, for example, we're treating more strokes than ever before. Patients have delayed care for too long. Rest assured, our hospitals and clinics are safe. We have rigorous safeguards in place to protect patients and staff. These include limiting visitors, screening everyone that enters, strict PPE requirements, robust cleaning and sanitization, social distancing throughout our facilities, constant masking, and increased testing. So if you need preventive care, like a colonoscopy, mammography, immunizations, or you have some long-term chronic disease that needs follow-up, like diabetes, come get evaluated. We want to see you in our clinics or virtually instead of in the emergency department. We need to keep you healthy. The second reason this increase in COVID cases is coming at a bad time is the flu season is approaching. Especially this year, it's important that you get a flu shot. It might be less convenient than in the past, but there's plenty of opportunities locally to get that vaccine. Given some of the capacity concerns I mentioned earlier, we don't want you to get sick. Go to essentiahealth.org and click on the Get Your Flu Shot button on the homepage. We've learned a lot about how to treat COVID, so we'll take great care of you if you're infected and need our help. But this is where you can help us prevent the storm by doing your part to stay healthy. With the rise in COVID-19 across our region, we urge you to remain vigilant. This is not the time to let your guard down. In fact, with the prevalence of community spread, and as we spend more time indoors, some of those precautions you hear so much about have never been more important. Please wear a mask and wear it correctly. It doesn't help if it's not covering your nose and your mouth. It won't protect you or others. And the evidence is indisputable. Don't listen to the non-expert who says masks don't matter. Experts from organizations like the World Health Organization, CDC, state departments of health, and hospitals across the globe agree that masks can help prevent or slow the spread of COVID-19. Continue also to practice social distancing. and avoid large gatherings. Be aware of any gathering indoors unless it's your own home. This virus primarily spreads indoors, hence why we are very nervous about this upcoming winter as people spend more time inside. Be mindful of good hand hygiene and stay home if you're sick. It's not just about you. You may think you're young or healthy, and that COVID won't be more than an inconvenience if you get it. However, think about your loved ones that could easily spread the disease to, that might have a devastating result. While we at Essentia continue to pursue enhanced access to testing for our patients and for others, there's only one piece of the puzzle for getting through this pandemic. So much of the community's success in navigating COVID-19 is dependent upon you. If we want to get back to the things we love, school, in-person school, sporting events, traveling, we must be better. Because the unfortunate reality is that if we don't take this seriously, it's going to linger and it's going to continue impacting our daily lives. It's going to sicken and kill even more people if you don't help us basically do the things that we talked about. Avoid each other, be very careful indoors, wear PPE, that social distancing. Really, this is the help that's going to prevent these problems and is going to keep everyone healthy going forward. So thank you, and I'm going to pass the baton to Dr. Van Dielen.
Thanks, Dr. Pryor. Some of what I'm going to say is just to reinforce what Dr. Pryor just mentioned, and I think it is worth repeating because it really is so important. I'd like to begin by discussing the importance of following the Minnesota Department of Health safety guidelines for COVID-19. It is crucial that everyone adhere to them. We need to be able to turn the tide and start reducing the number of COVID-19 cases in our region. We know that it's been a long year, and it isn't easy to continue avoiding all the things that we love doing. But we must, for the sake of our loved ones, our families, and our friends. The health of everyone is equally important. So please, as Dr. Pryor said, continue to avoid large gatherings. Practice social distancing when you are around others. Wear your face masks. And please wash your hands thoroughly. Whether you're out shopping or visiting loved ones at the hospital, it is greatly appreciated if you wear your mask properly and follow all other precautions. That goes a long way to protect the health not only of yourself, but others. Again, we know how badly everyone wants to get back to the lives that we're used to. And by following these precautions, it's the best way to get there. With the holiday season coming up, it's going to be even more important that we think about and continue being safe. We know that it's a time when you want to be with your loved ones, but we urge you to forego large holiday gatherings. It's important to avoid being in groups of people to stop the spread of COVID-19. Instead, we recommend you consider alternatives, like meeting outdoors where social distancing can be performed, or using platforms like Zoom to connect with those you care about. Again, we know this is difficult, but we are making sacrifices now to ensure that everyone is safer and still with us in the coming year. Thank you for your help with this. There have been some recent news stories about St. Luke's having employees who've been quarantined. Yes, we have had a varying number of employees in quarantine over the past 6 months. I'm sure many businesses throughout the region have experienced this as well. Quarantine separates and restricts the movement of people who are exposed or potentially exposed to a contagious disease to see if they become sick. We take the health of our employees and our patients very seriously, and we follow strict safety processes for employees who have known exposures or attended events with large crowds because we want to ensure we're doing everything possible to protect everyone's health and safety. We have an incredible staff that is working very hard and doing a great job. However, with increasing community spread, exposures can happen, and we're diligently addressing them. St. Luke's has been very busy in recent weeks. While we have noted a slight sustained increase in COVID-19 cases requiring hospitalization over that time, these patients really only represent a small portion of our volume. We are experiencing an overall increase in patient volumes, and we are prepared. We've been planning for months and are able to meet our patients' needs. It is critical that the community help to slow the spread of COVID-19 by practicing social distancing, again, wearing masks properly, washing your hands, and avoiding large gatherings. The Minnesota Department of Health's website also offers valuable information on safety protocols and can provide you with more information on recent hospitalization trends. I'd like to share that St. Luke's recently moved its drive-through testing site from Miller Creek Medical Clinic in Hermantown to St. Luke's Hospital in the former Emergency Department garage on First Street in downtown Duluth. It remains a drive-through service. It's just a little better protected for our weather. It is important to note that St. Luke's Respiratory Clinic is still located at Miller Creek Medical Clinic in Hermantown. That clinic is for people who have COVID-19 symptoms and acute respiratory issues. St. Luke's drive-through garage at St. Luke's Hospital is for people who have either been exposed to someone with COVID-19 but does not have symptoms, or given an order for a COVID-19 test at that location by their healthcare provider. The current hours for the drive-through garage are 8 a.m. to 4:30 p.m. Monday through Friday. No appointment is necessary. You should just pull up to the garage doors, remain in your vehicle, and wait for a staff member to open the garage door so they can drive in and be tested. We, like our neighbors down the street, are seeing an increased demand in testing, and we appreciate that people understand the importance of being tested when needed. The earlier the disease is detected, the sooner people can isolate and protect others. Finally, I'd like to close by thanking our partners in the media. You've done a tremendous job of following the story and keeping our community informed. We greatly appreciate that. With that, I'll turn it back to Louis.
Thank you, Dr. Van Dielen, and thank you to Dr. Pryor. Now I think we can open it up for questions. So if anybody wants to ask a question, remember you can raise your hand and we'll call on you. Otherwise, you can submit it via the Q&A button at the bottom of your screen. One question, and this might be for anybody, is when we were having these press conferences back in the spring, we really didn't have much COVID-19 here in this region. Why do you think it took as long as it has for it to really set up shop here the way that we've seen in the past month or two and become as prevalent as it has?
I'm going to tackle that, Dr. Prabhu. I mean, every virus pandemic has its genesis. So it typically hits, say, large population centers because they're very congested per se, high population density. But as you know, Northland's a very common tourist destination. So people frequently come here from all over the country, from the cities, and all it has to do is start with just one person, and it can exponentially increase. So looking at our data, I mean, our positivity rate, guess what, that go through our testing facilities is like 15%. So if you have symptoms, the odds are like almost 15% are positive. When this started, it was under 1%. And that's a reflection of how much more COVID is in the Northland.
Thank you, Dr. Prabhu. We have a question from Brooks Johnson with the Star Tribune. Can both health systems talk about plans in place if patient needs exceed your hospital capacities?
Sure, I'd be happy to start. So, we do, well, Essentia Health hospitals, we have experienced high volumes of inpatients over the past few weeks. We know that other hospital systems throughout Minnesota have had high volumes of inpatients as well. And as I talked about in my opening remarks, a lot of this, in fact, the majority of this is currently from just medical disease. It's not necessarily COVID. We do have COVID patients, they are increasing, but that's not what's driving this high census. So our census fluctuates on an hourly basis. Our teams are constantly monitoring that volume and are managing it as needed. We have internal processes and surge plans in place to respond to these fluctuations in census. And these processes involve managing staff and resources, triaging patients as appropriate, and occasionally transporting patients between Essentia Health facilities. So we want to treat the right patient at the right place. And sometimes that means we can treat somebody in Superior, or we can treat them in Virginia. And we do also have telehealth, and so we can help monitor at those remote sites. Obviously, the sicker they are, the more likely we are going to want them to come to St. Mary's Medical Center here in Duluth. While we have seen an uptick in COVID patients over the last few weeks, we don't believe that the sole reason is from COVID patients. It's primarily these patients with medical problems, but we do expect there to be a shift in COVID patients, or increasing number of COVID patients as we enter this winter season, as I talked about, and people move more indoors where COVID can spread. And then also, as I said, in terms of the perfect storm, we've got flu. We think that we've got the people and the resources throughout Essential to manage patients, both patients that start in the Essentia system, as well as helping and working collegially with other health systems. And again, part of this is telehealth and having the less sick patient hopefully staying at some of the local hospitals and then transporting them to us when they need that higher level of acute care.
Yeah, I can weigh in on that as well, Louis. So St. Luke's has been actively working with our regional partners as well, along with our colleagues at Essentia. In the same vein, I think we all know that there are some patients are better served at some sites, and certainly we want to be available to help our regional partners manage patients that just have needs that outstrip what they can provide in their community. And yet, when those patients when we have patients who have been hospitalized but are stable and can return to their community, we want to be able to do that as well. So we're actively working on those sorts of care sharing arrangements that are really patient focused to, as Dr. Pryor said, get the right patient, the right care at the right place and time. I think we also work closely with the state. We're all represented at the Northeastern Healthcare Coalition, which is tied to the state and is constantly monitoring the level of hospitalizations across the state and where they're impacting different healthcare systems. We, both St. Luke's and Essentia, feed our data into that system and participate at that level. And also the Critical Care Coordinating Center, we participate in that. So there is a statewide system that helps us pay attention to and manage areas of the state that are experiencing significant influxes in patients. And then finally, we're working with our nursing homes and assisted livings, really our post-acute care partners, who are experiencing many of the same challenges we are. They are caring for patients with COVID and also, like us, increased numbers of non-COVID patients, and struggling with staff getting exposed and being quarantined. And so we're working with them too to try and support each other so that patients who can move out of acute hospitalization can move out in a timely and expedited fashion. And we greatly appreciate that partnership. So lots of coordination being done across the region.
Yeah, I'd like to just say one more point, which is the coordination is not just, as you point out, Dr. Van Dielen, is not just with St. Luke's and Essentia, which has just been a remarkable partnership, and the local community, our local community hospitals, but really across the state. And some of this happens through Minnesota Hospital Association, which is a trade organization, and that's been outstanding. I think virtually every single health system belongs to MHA, and they've been meeting on a very regular basis and helping each other, not just sharing information, but when one health system or hospital is too full, they work with the other hospitals, and we take both St. Luke's and Essentia have taken patients, for instance, earlier on from the Twin Cities, and we know that if we get too full, that they'll do the same for us. So it's been a remarkable collaboration across all the health systems in Minnesota.
I'm going to jump out of order just a little bit here in the way that questions were submitted, because I think this is a follow-up to that previous question. And both healthcare systems, both Essentia and St. Luke's, kind of answered this, but as a follow-up, how close are you guys to maxing out patient capacity?
So I can speak for St. Luke's. We have been running, I would say, at capacity for several weeks now. And as we mentioned earlier, most of those patients are non-COVID patients, but we know with the increased numbers of COVID patients in the region, it's additional challenge to our ability to manage those. So we are actively looking at our system and trying to identify ways to be more efficient running at capacity.
And I would say, and Rajesh, I'm going to pick on you also, we also have pretty close capacity, but as I said, we've got lots of processes in place, and I think the benefits of being a large rural healthcare system is that we rely on our hospitals, and we've really been acting like a system in this. And we also have a very detailed surge plan. So as the COVID patients increases, we know that we're going to basically expand into some other areas that we normally don't have patients, and we've got the staff to care for these. Rajesh, do you have any other comments you would like to make on that?
I think the point, hospitals running at capacity even have COVID. So we have a lot of ill patients that we take care of, but the majority are non-COVID patients. So we have the resources currently to manage the COVID patients that we get. But that's the point of Dr. Pryor had mentioned, is the preventive care. The first moment that you feel you're ill, don't delay care, because it could potentially escalate instead of being managed in the outpatient setting.
Is there any particular trend with where people are catching COVID? Indoors was mentioned, but any particular place indoors? Are we talking about bars or restaurants, homes? Can you elaborate on that?
You want me to go first, Dr. Thompson, or you want to go ahead?
I'll start it off. Yeah, Andrew Thompson from St. Luke's. Some of the trends we're hearing about from the state epidemiologist at MDH are that people are catching this at smaller gatherings. We know that large gatherings are a risk. We know that any gatherings are a risk, but it's those interactions you have with people that aren't a part of your household that might be, closer, and if you're unmasked, present a higher risk. And so multiple small interactions in people sort of outside your household or outside your bubble are where they're starting to see an increased number of cases. We know that restaurants and bars are an increased site where people are at risk of catching COVID. And so really it is what we were concerned about, indoors in areas, unmasked, with people outside your household.
Again, just to add, the other part is, even with within your household, it depends what your household members do. once they leave the house. So it's not uncommon for family members to do particular outings with other people and let their guard down in terms of appropriate, masking, social distancing, hand hygiene, and then they bring it home. So, they may be younger folks, but then they potentially infect other more vulnerable family members. And that's what we're seeing. I mean, all the typical risk factors or the places of getting infection is the same. It's just higher numbers in all those categories.
For doctors who have treated COVID patients, what are you hearing from them after the fact? Are they surprised at the strength of this virus, or that it impacted them the way it did? Any anecdotes that you can share?
So what I've heard from patients really reflects the wide spectrum of illness that people can have. I mean, some people will have very mild symptoms, a runny nose, a stuffy nose, a few fevers. But and that represents the majority of illness, and those people are usually in the outpatient setting. On the inpatient side, though, when people have become sicker with COVID, they can have lingering symptoms that go on for a long time: muscle pains, fatigue, and of course respiratory symptoms that can persist. And those more long-term symptoms, we don't really know, in our limited experience, we don't know how long that's going to last and how the lasting effects will impact people.
I mean, Dr. Prabhu, what I've heard from people, I think to me, COVID's unpredictable. So we talk about who's the most vulnerable part of the population. And remember, at the beginning, we were protecting our long-term care facility resident nursing homes because we knew that if they got COVID, there'd be a higher rate of admission and death. But I think what people realize is, people will be spontaneously, communicated. It's like these younger people with no major health issues, they're just kind of shocked at how sick they felt and how long their hospitalization is. And then even if they make it out, get discharged, it's a long road to recovery. And on the other end, just because you're 70 or 80 does not mean you'll have a severe case. Some of those patients have relatively mild cases, even milder than, say, some of the younger people in the hospital. So the best thing is to prevent getting infected because it's unpredictable. And so the masking, social distancing, and I think if you do those measures, you can still, do your activities outside the house, but it's just those extra steps you have to do.
I'd just like to reinforce what Dr. Prabhu just said. My experience has been the unpredictability of who and how this illness affects people. It is, I would say, my experience has been that it is highly infectious, and I think that is, its spread in our community is quite a reflection of that. But I think, again, if you're young and you think you're just going to have a cold, while most will just have those sorts of symptoms, some will be severely affected. Similarly, while more elderly individuals and individuals with significant underlying cardiac disease, diabetes, more of them will have severe disease. There is a significant portion of those individuals, too, who will have very mild disease. So it's the unpredictability and the infectivity that impresses me most.
I have a question from a viewer online about herd immunity, and I'm just wondering if this is something anyone wants to tackle. What that entails, what that looks like. Are we close? I don't think we are, but maybe some of you can speak broadly to that.
The concept of herd immunity is usually discussed in terms of vaccination. Like we have to reach a certain level of vaccination for, say, measles to achieve herd immunity. And so there are estimates about what that would take for COVID. We don't actually know what the threshold of herd immunity is, but it's certainly higher than 50. It might be 70% of people. We don't actually know that we could reach that in a natural state and have people maintain that immunity. And the thing that it would require is an effective vaccine. If we were to allow our population to just become infected and throw caution to the wind, estimates are that many millions of people could die. So herd immunity is not considered by most experts to be a viable strategy here. And what I'm recommending is that we follow the guidance of our experts, our epidemiologists, and do all we can to contain this until we have a vaccine that's effective and safe.
I think as a follow-up to that question, Dr. Thompson, or anybody who wants to weigh in, we've all heard and read so much about a vaccine. It's become a little bit of a political issue. But if and when that vaccine, that first one, becomes available, what would you say to people who are on the fence about taking it over concerns about safety?
Yeah, well, vaccines are only approved by the FDA and recommended by a panel of experts who make recommendations about vaccines when they're proven to be effective and when they're proven to be safe. And there are numerous vaccines out there. They're still being studied, and what we're awaiting is that data. We want to be sure that they're safe because it's the nature of a vaccine. You're giving a vaccine to a well person, and we have to be certain that they're safe before we give this broadly to the community. I think there are well-established safe processes in place. The FDA has been doing this for many decades, and so when a vaccine makes it through their process, and they will be transparent about the data supporting that, I'm confident it'll be safe, and I'll be happy to get one.
I don't see any other questions being asked or hands raised, but I did want to take this opportunity to see if any of our doctors have anything else they want to add, something that wasn't touched upon here that you'd like to convey. Kind of putting you on the spot here, but if you have anything you want to share, feel free to jump in.
Yeah, Dr. Pryor, I think the key is prevention. It's just don't get COVID in the first place. You can leave the house, go outside, but wear your mask, social distance, hand hygiene, and those are the best things you do. I do that. You can still enjoy your activities outside the house doing those things. And it's if you're feeling ill in any way, contact your medical provider to seek treatment. It's safe to come into our facilities to get evaluated. Don't delay.
Yeah, I would. Go ahead, Andrew.
Yeah, I would also add to that. I completely agree. It is safe to continue doing things. We have to take a few extra steps. And I also want to really reinforce the idea that we have to address this as a community. We can't think only about ourselves, because if we can work together as a community, we can keep all of our neighbors safe as possible in a pandemic, but we can't go it alone.
Yeah, in that vein, masks work and they protect those around us. So wear your mask. We're all tired of this pandemic. But we know that especially as we move into respiratory illness season and move indoors because of our weather, that we're going to be at significant risk, and things are going to look similar, perhaps even worse than they did last spring. So I can't reinforce enough the importance of masking, social distancing, and hand washing. So this is something that our community did so well, and really has done well for the past 7 months now, and we really appreciate your partnership in this. And those are the tools we have available. So hang in there. Thank you for your partnership. Our hospitals and clinics are safe and available. So if you have an illness, seek treatment. If you have questions, contact us. And finally, I just make a plea that get your flu shot. We need as many people as possible in our community to get their flu shot this year, because that will really help in regards to the burden of respiratory disease. So thank you.
I would echo everything Dr. Van Dielen said. I think that if you need preventive care, if you need to get your medications adjusted, if you need help for whatever reason, the hospitals and the clinics are safe, and we can always start off with virtual care if necessary, but don't delay the care, because that's part of what's creating the issue right now in our hospitals, why they're so full. Second thing is, again, get your flu shot. Totally agree with that. And then even on the masking and social distancing, I would say if you're outdoors and you're more than 6 feet, clearly more than 6 feet away from other people, I don't think in general you need to wear a mask. It's pretty safe to be outdoors and not wear a mask. But when you're indoors, just actually stay away from indoors where it's not your home. I realize we have to go to the grocery store, go there, get out. Just try to minimize your time where the public is indoors with you, and for certain wear a mask, and for certain stay 6 feet away. When I go to get groceries, I never really played football, but I feel like I'm a running back trying to stay 6 feet away from people. And it's probably pretty comical, but I think it's important to do to maintain my health. I'm asking you to do the same. So stay healthy.
I think that's going to do it for this morning. Thank you to all four doctors for taking some time out of your busy schedules and joining us here today. I don't anticipate this becoming a weekly occurrence like we did in the spring, but we'll certainly revisit it again if and when we need to. Again, thanks to the doctors, and thanks to reporters for joining in. If you have anything after the fact, reach out to myself or reach out to St. Luke's, and we'll do our best to help you out. Thanks, everybody.
Thanks all.